Thank you very much, Rob. Our third speaker is John McLaughlin, who is Vice President of Population Studies and Surveillance at Cancer Care Ontario and a professor in the Dalla Lana School of Public Health at the University of Toronto. He serves the Ontario Institute for Cancer Research as the project leader for prevention, where he leads a provincial consortium in developing and launching the Ontario Cancer Cohort. As a leader of provincial initiatives at Cancer Care Ontario, Dr. McLaughlin also works to improve our knowledge and apply it in population-based cancer prevention, screening and surveillance programs with the ultimate goal of reducing the risk and burden of cancer in Ontario. Dr. McLaughlin.
Thank you, John, and good morning, everyone. Well, one of the foundational principles that I think all Canadians recognize is at the heart of being Canadian is that when we provide health services and we care for the health of Canadians, everyone counts. And that's really one of the primary perspectives that I would offer in addition to the points that my colleagues have added. So as an epidemiologist, as a scientist, we're responsible for and conduct population-wide studies and surveys with the aim of improving health across all of Ontario, my role in Cancer Care Ontario, but also across Canada with my colleagues in other provinces. I, like many researchers, rely on information about the entire population. Canadians should be proud of the quality of the information that we do collect in Canada. The census is a foundational part of that, and the long-form census is a foundational part of that. We have excellent data that comes from the census. It is a place where all Canadians count, and all Canadians can and should be counted. Data from the long-form census is used by us to advance our healthcare programs, including at Cancer Care Ontario, including in other provinces and across Canada. And also for the research community, like myself as a professor of public health, we use this to advance knowledge about why illness occurs, what we can do to prevent it, what we can do to improve health. The long form of the census is a crucial source of detailed and high-quality information about the social, economic, and cultural factors, data that's not available anywhere else in Canada, and it is relevant to the health of all Canadians. It's unfortunate timing for this particular decision to have been made, because just at the time that it's becoming quite clear that to really advance and improve health and health services, it's becoming clear that this is the time that we should be addressing the disparities that do occur across the population. And so our funding agencies, researchers, clinicians, health policy organizations are just beginning to understand that to improve the effectiveness and the efficiency of the healthcare system, we really must identify and address the disparities that are occurring. And again, the type of information that comes from the long-form census is the foundation for us to understand what these patterns are across Canada. Similar to my colleagues, as an epidemiologist, we're very, very concerned about the biases that would occur by relying on a voluntary form of data collection. These are specific challenges. There are many ways in which response rates and these biases can be managed, but simply deleting or omitting the long-form census at this time is not the solution. As a vice president at Cancer Care Ontario, I know too that the long-form census data is fundamental to our work. In particular, it's the basis for planning of population-wide strategies for cancer control, and in particular in my area of work, this is critical for us to really improve cancer prevention programs and early detection or screening programs. Extensive research from a variety of domains has clearly established that human health is closely linked to our physical environment and to the social, economic, and cultural factors. And these do have profound impacts on how people live and how their health evolves. And the census information is critical to measuring those social, economic, and cultural factors. One of the implications of withdrawing the mandatory long-form census would indeed be that, as I've said, first of all, we would have trouble uncovering and addressing health issues that are important to everyone, but especially to the underserved populations. We would also be unable to track how changes that are occurring now relate to what has happened in the past, so monitoring patterns and trends across the population over time. And also, we would not be able to understand the role of the cultural factors, both new immigrants coming into the country, how our population is changing, and how health is changing across the country. So in conclusion, I would just hope that the serious concerns expressed by myself and my colleagues here today, and by similarly interested individuals and organizations across the country, will at least open the door for a dialogue with national leaders to ensure that the census really can best serve Canadians. Thank you.